Welcome everybody back to the weekly show. So happy to be here with all of you today. It has been great to interact with so many of you. Appreciate your emails and comments. And I wanted to follow up today on the weekly show about a topic many of you found very helpful a few weeks back when I did a show on things that pre-medical aspirants and aspirants to get an accelerated medical programs can do in high school to improve their chances of getting into a top-tier medical program. One of the things I talked about in that show when I talked about translational medicine was how students should show colleges very early in their high school career that they have pursued their passion for medicine. Like a snowball keeps rolling, keeps getting bigger, your interest grows, you pursued it, you had new insights along the way, you learned something new, and you had a very big picture look at the medical field. That's what they like to see, that you are, especially the accelerated medical programs. When I've worked with many of my students who've gotten into accelerated medical programs, top tier programs, they will ask them questions like, what do you believe is the biggest problem in medicine today? What do you believe is the most significant problem in medicine today? They want to see that students have an idea of what's happening in the field. And one of the ways to show that is very early on in high school, begin studying it, taking courses on it, doing extra research on it, and demonstrating through your essays, through your interviews, through the classes you've taken, and other ways that you have an understanding of problems our society faces in medicine. One of the topics I want to talk about today on this note is called Social Determinants of Health. So let's talk about what that means and how high school students can leverage this concept to improve their chances of getting into a top-tier medical program. Social determinants of health are factors that contribute to the quality of healthcare people receive. The determinants are another words for factors such as the places people live, their background, their ethnicity, their race, their socioeconomic and financial status in our country, the language they speak, whether they have a language barrier. All of these things, all of these factors affect the quality of healthcare that people, unfortunately, people receive in our country, the United States. All over the world as well. We're focused on the United colleges in the United States right now. Okay? So all of these things can significantly affect the care. So if you contrast it, where on paper, legally, everybody has the right to health care, but it doesn't always work out that way. And we're not talking about cosmetic care, plastic surgery, dental implants, things like that. We're talking about basic human care. We all know in our country, we've heard horrifying stories in the news, people dying because they don't have proper health care coverage. That is an unfortunate reality in the United States. And top-tier programs, colleges, top-tier medical programs want to see that students have an understanding of systemic inequalities in medicine. Okay? And when it is, if it's widely understood, even the World Health Organization has said addressing these determinants are key to reducing health inequities in the world and improving public health outcomes globally. Very important to understand what are the factors that contribute to inequitable treatment in healthcare. So we're not talking about equal treatment, we're talking equitable. Nothing is ever going to be equal. We're always going to have people that can get the best lawyers, get the best everything, but we want to make things as fair and equitable as possible so that people have an opportunity to get the basic care they need in everything. And we live in a society where, the fire department you get the same treatment, unless there's exceptions, usually the same treatment from the fire department, whether you're a billionaire or you're a person with limited means. The fire department puts out the fire, they're not concerned with your means. We all get the same treatment. That's a public service. And we're all treated equitably and pretty equally when it comes to the fire department. Well, it's not the same way when it comes to healthcare. And there are factors that determine the level and quality of healthcare people get. Poor social determinants, when people have lower income, when they don't speak the language, they can't advocate for themselves, when they don't have quality healthcare, that can lead to chronic disease, lower life expectancy. And we have to really understand why this happens. And it's an ongoing debate in our country about how to solve these inequities. When we talk about high school students, colleges love to see students that have studied these things, social determinants of health, what are the determinants that affect the quality of healthcare, and love to see students, especially schools like Brown University, Johns Hopkins, that are interested in not just becoming a doctor for the title, but are interested in using their health career, their career in the medical career, to reduce inequity in healthcare. Okay, and that is something that schools, top schools, their public health departments, at schools like Johns Hopkins, Harvard, love to see students passionate about. And there's not just big schools, there's smaller schools too. Amherst College, Massachusetts, Swarthmore, Pennsylvania, Tufts University. These are very highly reputable schools that highly value students with an understanding of these systemic health challenges. And they offer interdisciplinary programs that help students help solve these problems, learn how to solve them, learn what's happening, because it's not just a medical issue at all. It's a sociology issue, psychology issue, understanding legislation and how bureaucratic ossification when it comes to legislation. Very important to understand these things when trying to understand and solve the problems that come with healthcare inequities, and understanding these social determinants, again, that affect these inequities. And it's very important for students to understand that communities with limited health options, healthy food options, and safe recreational spaces to go out and play and be active have higher rates of diabetes, heart disease. And this is really, our society is not stratified equitably, and it's never going to be perfect. And nobody, and that's kind of, it's utopian to think it can be, but colleges want students that at least have a desire to help with this. And how can students do this in high school is the next important question. How can students demonstrate to college, I am interested in and have a solid rudimentary understanding of social determinants of health that affect healthcare outcomes in the United States and worldwide? There are online programs through Coursera, through many other colleges offer their own online courses, free courses to educate the public. One way students can explore this issue as well and demonstrate their interest in it is volunteering in underserved communities, being involved in advocacy programs, getting involved in lower income areas, in some urban areas, and working in shadowing in clinics, volunteering in clinics. That will give them exposure to these inequities, and they can talk about this in their essays. I have helped my students articulate what they've seen. One of my students, he was an incident he said he will never forget. He was talking to a man in the hospital who had some diabetes issues, and the man opened up to him, and when he was volunteering at the hospital, told him that he had to choose between his health care and his son's college and paying for this. And it opened my students' eyes to the realities of an inequity. It wasn't just something you read about, it was something you're meeting people up front. One of my other students talked about in his essay, got into Johns Hopkins, about how something that stuck with him was working as an EMT on the ambulance and seeing how somebody would not get into the ambulance because they couldn't afford the healthcare bill. And that just blew him away to how much of inequity and how much financial situations affect healthcare outcomes. And as we mentioned, this is not through many fields, like we talked about in many aspects of society, like putting out fires with the fire department. We have not generalized that theory that public health, that healthcare is a right yet in our society. There's ongoing debate about that. We are one of the few industrialized countries that does not have a healthcare system, a universal healthcare system. Whether we should go there or will go there is up for debate. But whether we should have a more equitable healthcare system seems not up for debate anymore. It seems most people agree that should be the goal. The question in society now that political debate spurns is, how do we get there? Means, not ends. And as a student who has a vision of where society should go and might not have all the solutions but knows they want to be part of that solution, it can be very interesting and very valuable to a college who would love to have a student like that on campus, because it shows empathy, compassion, global awareness, big picture thinking, and an interdisciplinary understanding. And it definitely will make them stand out in their college applications, especially their applications to accelerated medical programs. Again, with this interest in social determinants of health and systemic health issues, and showing a commitment to equity and as much equality as possible. Okay, so I hope today, again, building what we learned about a few weeks back, the previous show, in a previous episode about translational medicine, Translational medicine, again, is taking findings in the lab and bringing them as quickly and expeditiously and safely as possible to a real-world solution. Was a great thing for colleges to see students understand as they're applying to college. We finished talking today about social determinants of health, understanding how they affect the quality of healthcare in the United States. Hope today was helpful for those of you, especially those of you who have children or guidance counselors listening. Many of you are guidance counselors wrote in how this was helpful to you. Students who want to apply to pre-med programs and they're younger especially, they can show an early interest in this topic in high school, and to have on their resumes and their track record and show a genuine empathetic understanding of this issue can be very helpful. Social determinants of health. Again, thank you for tuning in today. Hope it was helpful. It was great to be here with all of you, and look forward to being with you all soon. Have a great day.